Chronic obstructive pulmonary disease, or COPD, is a long-term lung disease that obstructs airflow and makes breathing difficult. The understanding of COPD has evolved over centuries. In the 17th century, doctors began documenting symptoms similar to what we now know as COPD, but it wasn't until the 20th century that modern medicine identified it as a specific condition. Today, COPD is a leading cause of death and disability worldwide. COPD primarily includes two major conditions: chronic bronchitis, which is characterized by inflammation of the bronchial tubes, causing a persistent cough that produces mucus, and emphysema, where the air sacs in the lungs are damaged and lose their elasticity, making it difficult for air to move in and out of the lungs, leading to shortness of breath. Most people with COPD have a combination of both chronic bronchitis and emphysema. The primary cause of COPD is long-term exposure to substances that irritate and damage the lungs, including smoking, which is responsible for about 85 to 90% of all cases, exposure to air pollution, workplace exposure to dust and chemical fumes, and genetic factors like alpha-1 antitrypsin deficiency. Symptoms of COPD often develop slowly and worsen over time, with key symptoms including shortness of breath, chronic cough that produces mucus, frequent respiratory infections, wheezing, fatigue, and chest tightness. As the disease progresses, even simple tasks can become difficult. COPD is a significant global health issue, affecting more than 300 million people worldwide and being the third leading cause of death, responsible for 3.2 million deaths annually. The burden of COPD is highest in low and middle-income countries, where access to healthcare is often limited, and deaths are expected to increase due to aging populations and continued exposure to risk factors. While there is no cure for COPD, it can be managed with lifestyle changes, medications, and medical procedures. Key treatments include quitting smoking, bronchodilators to relax airway muscles, inhaled steroids to reduce inflammation, oxygen therapy for advanced cases, pulmonary rehabilitation to improve quality of life, and surgery in severe cases. Preventing COPD involves avoiding risk factors such as not smoking, minimizing exposure to harmful fumes, exercising regularly, and getting vaccinated against respiratory infections. COPD is a debilitating and progressive lung disease that affects millions globally. While there is no cure, early detection, lifestyle changes, and medical management can significantly improve quality of life and slow disease progression. Raising awareness and providing better access to healthcare can help reduce the global burden of this serious disease.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.